नमस्ते, यहाँहरूलाई स्वागत छ मेरो च्यानलमा। आज चाहिँ म तपाईहरुको लागि लोकसेवाले लिएको एक्जाम 2077 साल फागुन 23 गते लिएको एक्जाममा आएका क्वेशनहरु चाहिँ लिएर आएको छु। यो क्वेशनहरु चाहिँ खासमा केमा भन्दाखेरि लोकसेवाको लागि मात्र नभई कुनै पनि एक्जाम प्रिपरेसन त्यसैगरी लाइसेन्सको लागि पनि उत्तिकै महत्त्वपूर्ण छ। त्यही भएर आशा गर्छु तपाईहरुलाई केही हेल्पफुल हुनेछ। Which of the following should the nurse implement to prepare a client for KUB radiography test? Client must be NPO before the examination. No special orders are needed for this examination. Enema to be administered prior examination. Medicate client with diazepam 10 mg orally at 10 p.m. And the correct answer is B. No special orders are needed for this examination. Which of the following drugs is proton pump inhibitor? Cimetidine, omeprazole, pyrenzepam, misoprostol. Correct answer is B. Omeprazole. Which of the following blood tests should be done before a blood transfusion? CBC, bleeding and clotting time, prothrombin and coagulation time, blood typing and cross matching. The correct answer is D. Blood typing and cross matching. For a lumbar puncture, a patient is placed on dash position, Sims position with a pillow under knee, side lying with a pillow under hip, prone with a pillow under the abdomen, side lying with the legs pulled up and head bent down onto the chest. And the correct answer is D. Side lying with the legs pulled up and head bent down onto chest. A patient admitted to the ER with renal calculi and is complaining of moderate to severe flank pain, nausea and 100° Fahrenheit fever. The priority nursing goal for this patient is maintain fluid and electrolyte balance, control nausea and fever, manage pain, prevent urinary tract infection. And the correct answer is C. Manage pain. Elderly people have a high incidence of hip fractures because of carelessness, fragility of bone, rheumatic disease, sedentary existence. And the correct answer is B. Fragility of bone. The most common cause of GI bleeding is esophagitis, esophageal varices, peptic ulcer disease, hemorrhoids. The correct answer is C. Peptic ulcer disease. What will be the best method for newly married couple? IUCD, oral pills, mini-lab, vasectomy. The correct answer is B. Oral pills. Demography is the scientific study of human population, human being, human behavior and mind, people and culture. Correct answer is A. Human population. Vitamins and minerals are included in macronutrients, micronutrients, micronutrients, major nutrients. The correct answer is C. Micronutrients. Which one of the vitamin is known to have a role in wound healing? Vitamin C, vitamin A, vitamin E, vitamin B complex. Correct answer is A. Vitamin C. If a woman misses one pill of OCP, then she should be advised to take as soon as she remembers and continue the packet as usual. Take 2 pills at a time and continue the packet as usual. Not to worry and follow regular schedule of pill. To take any pills at all. And the correct answer is A. To take as soon as she remembers and continue the packet as usual. When mother with 36 weeks of gestation have raised her blood pressure more than 160 by 110 mm of Hg on 2 separate occasions, proteinuria is more than 0.5 mg per liter in 24 hours with generalized edema and puffiness on face, what could be diagnosis? Mild preeclampsia, eclampsia, moderate eclampsia, severe eclampsia. And the correct answer is D. Severe eclampsia. Following a precipitous delivery, examination of the client's vagina reveals a 4th-degree laceration. Which of the following would be contraindicate when caring for this client? A. Applying cold to limit edema during the first 12 to 24 hours. Instructing the client to use 2 or more peripads to cushion the area.
Instructing the client on the use of sheath bath if ordered. Instructing the client about the importance of perineal exercise. Correct answer is B. Instructing the client to use 2 or more peripads to cushion the area.
Placenta retent is defined if the placenta is not separated within 15 minutes of baby delivery, within 30 minutes, within 5 minutes, within 45 minutes of baby delivery. And the correct answer is B. Within 30 minutes of baby delivery. The main features of placenta previa is painless vaginal bleeding with colicky, lower abdominal pain, sudden onset, painless and recurrent vaginal bleeding, anemia is improportionate, And the correct answer is A. Painless vaginal bleeding. After fertilization, the fetal heart begins to beat during 4th week, 5th week, 6th week, 7th week. Correct answer is A. 4th week. The nurse caring for a patient who is in the first stage of labor. What is the shortest but most difficult part of this stage? Active phase, complete phase, latent phase, transitional phase. And the correct answer is D. Transitional phase. Which of the following hormone is responsible for ovulation? LH, FSH, progesterone, testosterone. And the correct answer is A. LH, luteinizing hormone. Gestational age is calculated from calculation from LMP, height of the uterus, calculation from the day of ovulation, calculation from the day of fertilization. And the correct answer is A. Calculation from LMP. Women complains of infrequent irregular times episodes of bleeding usually occurring at the interval of more than 35 days. This irregularity of menstrual cycle is called menorrhagia, metrorrhagia, oligomenorrhagia, polymenorrhagia. And the correct answer is C. Oligomenorrhagia. Rh isoimmunization causing hemolytic disease occurs if mother is Rh positive and child is Rh negative. Mother is Rh negative and child is Rh positive. Both mother and child is Rh positive. Both mother and child is Rh negative. And the correct answer is B. Mother is Rh negative and child is Rh positive. Which is the most common STI caused by bacteria? Gonorrhea, chlamydia, syphilis, genital warts. Correct answer is B. Chlamydia. Projectile vomiting and olive-shaped mass is palpated in epigastric region. Both are clinical feature of hypertrophic pyloric stenosis, celiac disease, intussusception, or ganglionic megacolon. And the correct answer is A. Hypertrophic pyloric stenosis. What is the main features of vitamin A deficiency? Bitter spot, Koplik spot, erythema magnetum, Aschhoff nodules. And the correct answer is A. Bitter spot. Kernicterus, which may occur as a complication of jaundice, is a pathological condition of liver, brain, kidney, heart. And the correct answer is A. Liver. MUAC is measured by a tape called sellotape, cycle tape, inch tape, all of the above. And the correct answer is B. Cycle tape. Most of the sickness and death in children is accidents and injuries, cholera and malaria, diphtheria and whooping cough, infection and malnutrition. And the correct answer is D. Infection and malnutrition. When nurse enters a client's room, the client says, "They are crawling on my sheets, get them off my bed." Which of the following assignment is the most accurate? The client is experiencing aphasia. The client is experiencing dysarthria. The client is experiencing flight of ideas. The client is experiencing visual hallucinations. And the correct answer is D. The client is experiencing visual hallucinations. Nurse's best approach when caring for confused older client is to provide environment with space for privacy, group involvement, trusting relationship, different activities. And the correct answer is C. Trusting relationship.
Main side effects of anti-anxiety, especially with alprazolam, is dependence, insomnia, low mood, ataxia.
And the correct answer is D. Ataxia. What types of evaluation is done between the courses? Formative, summative, diagnostic, placement. The correct answer is A. Formative. Which of the following is a pull mechanism of motivation? Punishment, fear of losing job, promotion, threatening. And the correct answer is C. Promotion. The first process of controlling process is measuring the performance, establishment of standard, taking corrective action, determine deviation. And the correct answer is establishment of standard. The first managerial function is to forecast, predict, and determination of action to achieve the desired results is planning, organizing, directing, controlling. And the correct answer is A. Planning. Which of this statement is best to describe the characteristic of an effective reward feedback system? Specific feedback is given as close to the events as possible. Staff is given feedback in equal amount over time. Positive statements are to precede a negative statement. performance goals should be higher than what is attainable. And the correct answer is A. Specific feedback is given as close to the events as possible. Which one is closest in meaning to the question sentence? She said, let's try an American restaurant. She told to try an American restaurant. She said to try an American restaurant. She suggested trying an American restaurant. She spoke to try an American restaurant. She spoke to try an American restaurant. And the correct answer is C. She suggested to try an American restaurant. Choose the appropriate option to complete the following sentences. Dash we get to airport. Dash time will have first stopping before time takeoff. Whenever, just as, the more, the less, as much, the more, the sooner, the more. And the correct answer is D. The sooner, the more. तल उल्लेखित शब्दहरूमध्येबाट पुरै शब्द लेखेको विकल्प कुन हो? यसको चाहिँ राइट आन्सर हुन्छ सी. सुरक्षित वैदेशिक रोजगारी बारे सचेतनामूलक कार्यक्रम सञ्चालन गरिएको छ भन्ने वाक्यमा कतिवटा शब्दहरू अशुद्ध लेखिएको छ? यसको राइट आन्सर हो डी 4. र यसमा वैदेशिक रोजगारी बारे सचेतनामूलक र सञ्चालन शब्दहरू चाहिँ मिस्टेक छ. Hypotonic solutions have a lower concentration of electrolytes than plasma. A common example of a hypotonic solution is 0.45% normal saline, 0.9% sodium chloride solution, DS in 0.9% normal saline, Ringer's lactate. And the correct answer is A. 0.45% normal saline solution. Treatment of anaphylactic shock is done by adrenaline, antibiotic, antidote, furosemide. The correct answer is A. Adrenaline. When a nurse collected the data information that verbalized or stated by the client is known as objective data, subjective data, categorical data, continuous data. Correct answer is B. Subjective data. A nursing diagnosis represents the proposed planned care, client's health problems, assessment of client data, actual nursing intervention. The correct answer is B. Client's health problems. Oxygen, food, water, elimination, rest, etc. are the self-actualization, physiological needs, self-esteem, safety and security. Correct answer is physiological needs. Which of the following is known as roundworm? Taenia solium, Ascaris lumbricoides, Enterobius vermicularis, Wucheria bancrofi. And the correct answer is B. Ascaris lumbricoides. Ammonia is converted into urea in liver, stomach, pancreas, brain. The correct answer is A. Liver. Which one of the statements is correct about vesicular breath sounds? Inspiratory sounds last longer than expiratory ones. Inspiratory and expiratory sounds are about equal. Expiratory sounds last longer than inspiratory ones. Inspiratory and expiratory sounds are indistinguishable. And the correct answer is A. Inspiratory sounds last longer than expiratory ones. Adam's apple is present in trachea, larynx, pharynx, esophagus. Correct answer is B. Larynx. Name the term gives to the failure of bone marrow to produce RBCs: aplastic anemia, hemolytic anemia, thalassemia, hemorrhagic anemia. Correct answer is A. aplastic anemia. यस्तै भिडियोको लागि मेरो च्यानललाई प्लिज सब्स्क्राइब गरिदिनु होला. त्यसैगरी यो भिडियोलाई लाइक गर्न नभुल्नु होला. धन्यवाद.